Once you prophy both the lingual and the buccal sides of your teeth, you're gonna have prophy paste left over. With the prophy paste, you wanna just use your high suction speed and your water and kind of just get everything off. It just helps with less mess. And then you're gonna get everything nice and dry with your air. You wanna take your cotton balls. You wanna put them on the, well, for the lower, you're gonna put it on the lingual and the buccal side. And then you wanna take your one step, use your micro brush and kind of just rub it in on both the lingual and the buccal. Get them nice and, you'll kind of feel like a rough edge or a rough surface. But once you get the feel of the rough surface, you wanna kind of dry it again with your air. You take your light it for a couple seconds, and then with your band, you're gonna take some blue glue. If you want me to,
yeah, go ahead and put it in.
You're gonna take your blue glue. Before your blue glue, you are going to crimp your bands. And to crimp the bands, you're just helping seat the appliance better to make it a little tighter. So to crimp them, you just kind of go around the edges.
And what instrument are you using?
I'm using a bird beak. Kind of just go in a little bit.
And what's the purpose of crimping a band?
It's to help seat the appliance better and to help it lock onto the tooth better.
Yep, helps to make sure that it's more secure of a fit.
Yes.
Perfect, and you'll want to crimp your bands before you start prepping so that you don't get contamination.
Yes. And then you're gonna take your blue glue and you're going to just insert a little small amount on both sides, or all around actually. And then once you have that, you're gonna take your band, push it onto your tooth as best as you can. And then at that point, I usually have the patient bite down on the bite block, and they'll just push and bite, and it usually goes all the way down.
Crimped it too tight.
Yes, so this side, once they bite, it goes down. Usually the blue glue kind of seeps out the top part, and on the sides, you just want to take your glove or a cotton roll and just get off the extra. Once you have a good surface and it's locked on correctly, you want to take your light and just light the top part. You want to light the buccal and the lingual just to make sure that you're getting it lit all the way around for a couple seconds. And then once you do both sides, you can take everything out, have them rinse, kind of give everything a little tug to make sure that it's on correctly.